The route that your breath takes to enter the lungs is called the airway. Air can enter the body through the nose or mouth or both. At the back of the throat, the air enters the larynx and trachea or windpipe. Air is so important to survival that the trachea is always open except when we swallow food. At that moment, the epiglottis, a flap of cartilage, swings shut to allow food to travel over the top of the windpipe without entering it, except when, as people like to describe it, food goes down the wrong way. Usually it's just a tiny crumb that makes us cough and feel uncomfortable. However, choking can happen when objects or food become stuck in the entrance to this, the lower airway. The trachea forks into two branches, one going to the right lung and the other to the left. It's worth reminding ourselves that no respiration is taking place in the airway. The air has to travel a long distance from outside the body, through the nose or mouth, down the throat and windpipe, and then into smaller and smaller airways until they reach the alveoli. Only there can gas exchange take place. This is why it can be disconcerting to do snorkeling when on holiday at the seaside. The additional length of the snorkel means that your air has to travel even further before it reaches the lungs, so a deeper breath is needed to compensate for what is like having a super long trachea. Luckily, air travels fast, and even shallow breathers get enough air into their lungs to survive. But as we will see later, these people would feel much better if they developed better breathing habits. In the yoga tradition, breathing is done in and out of the nose with good reason. Using the narrower airway of the nose instead of the mouth makes it easier to control the flow of breath in and out of the body. And breath control is fundamental to yoga breathing and conscious control of breath. When yoga students are full of cold, have a nose problem, or simply a blocked nose, they will need to breathe through the mouth to avoid strain on the breath. At other times, breathing in through the mouth should be discouraged because the nose is the first line of defense for the body against airborne diseases. When you breathe in, ridges on the surface of the nasal passage force the air to spiral, throwing any particles, pollutants or pathogens like bacteria against the sticky mucus that covers the inside of your nose. Fast-beating cilia move the mucus up to the back of the nose, and every now and again you unwittingly swallow and send these invaders to be dealt with by stomach acid. In a second line of defense, the lining of the nasal passage is so thin that white blood cells from the immune system are able to push through the membrane and hunt down invading pathogens. This system works by slightly engorging one nostril at a time with blood, which is why one nostril is often more free-flowing than the other. Every couple of hours this engorgement switches to the other nostril, and in the tradition of Hatha Yoga, this regular switch of flow, or prana, in the nostrils is called Swara Yoga. Blood is warm, so breathing in through the nose also warms the air, as well as filtering it, before it enters the delicate lungs. Nose breathing will not mean you never catch colds and coughs, but it certainly plays a part in reducing the risk of the causes of these illnesses getting into the lungs in the first place.